Hello and welcome to our blood pressure classifications overview, which is part of our 2 to 3 minute recap series. We're firstly going to identify how blood pressure is measured and what the readings then mean. So blood pressure is measured in millimetres of mercury, so you will see the mmHg value written next to the numbers. Blood pressure readings are expressed in two values. We have the top value, which is what we refer to as our systolic pressure, and the bottom value, which is our diastolic pressure. Systolic pressure indicates the maximum amount of force within your cardiovascular system when your heart contracts, so it's the pressure against the artery wall. The diastolic pressure indicates the lower amount of resistance your cardiovascular system is experiencing during relaxation. So at that period of time where your heart briefly relaxes to refill back up with blood, that's where we would identify the diastolic pressure. Both values are equally as important, so we need to make sure we keep an eye on both of them. So if we look at some blood pressure classifications, we can see that an ideal blood pressure would be around 120 over 80 millimetres of mercury. So this value or under is considered ideal. When we get closer to 140 over 90, that's when we're starting to get towards the mild hypertensive ranges. Anything in between these two values is considered the high side of normal. So for example, a reading of 135 over 85 would be considered high side of normal. Once we get to 140 over 90, then we're in the hypertensive ranges, and it goes up from there to 160 over 100 for moderately hypertensive, 180 over 110 for severe hypertension. Now if you want an easy way to remember this, the systolic reading goes up in 20s typically for the boundaries, 120, 140, 160, 180, and the diastolic reading goes up 80, 90, 100, 110. When we work with diabetic clients, because they're at a higher risk of cardiovascular disease, we consider their blood pressure needs to be lower than the general population. So when we get to about 130 over 80, that's when we start considering people have more blood pressure problems. We want to keep it under this value if possible. An absolute contraindication to exercise would be someone that has a blood pressure reading of 180 over 100 or 180 over 110. Anything in that area means someone should not be exercising on that occasion, and their blood pressure should be monitored by a medical professional to check that they are safe and suitable to return back to exercise. And finally, low blood pressure can be indicated at a reading of around 90 over 60, but it really is dependent on the person as to whether this is a problem for them. So finally, just to touch on some key benefits of exercise. Exercise helps to normalise blood pressure, especially over a long period of time. It also helps to manage body weight, as people's higher body weight can be associated with the development of hypertension. It reduces the risk of coronary heart disease, so the vessels supplying the heart. It also increases blood flow to the muscles, it improves capillarization, and it increases myoglobin. There are many different benefits to exercising with this condition, and hopefully if you now have a better understanding of the blood pressure classifications, you can help educate people further on keeping their blood pressure under control and the benefits of exercise in the condition of hypertension.